the nurse has started a norepinephrine Levophed infusion in order to prevent complications. They know to frequently check the patient's urine output, mental status, respiratory rate, or peripheral pulses. That's a hard one. Now let's talk about the big boy, the one that you're going to use probably the most, Levophed. The generic name for Levophed is norepinephrine. That sounds really familiar. Haven't we talked about norepinephrine before? That's right. Norepinephrine is one of the hormones that your body uses in that fight or flight response. Norepinephrine is the hormone responsible for vasoconstriction in the body. So this is synthetic norepinephrine that we are infusing into the patient. Oh man, this is all making sense now. Levophed is a first-line vasopressor. So this is usually the first medication that we will add in an attempt to improve the blood pressure. It's a first line, and that means you need to be very comfortable with this medication. You need to know what it does, you need to know its side effects, and you need to be familiar with the dosage rates at your facility. Now, we're not going to talk about individual doses because it varies very widely facility to facility. So I want you guys to do some homework and go back to your protocols at your hospital, and I want you to look up what are the normal dose ranges for Levophed. Maybe you're at a facility where you use weight-based Levophed, mics per kilogram per minute, or maybe you don't use weight-based, it's just mics per minute. It's important for you to understand what these dosages are so you are comfortable using them in titration. Now, just like I said, this is a vasopressor. So what is the primary receptor that it's going to stimulate? That's right, the alpha receptor, because the alpha receptor is located in the blood vessels, and so when it's stimulated, we're going to get vasoconstriction. Now notice, at higher doses of Levophed, it can also start stimulating our beta-1 receptors. Remember, beta-1, one heart, it's found in the heart, and when stimulated, beta-1 receptors can increase our heart rate and our force of contraction. This can actually be beneficial in higher doses of Levophed because it's going to help the heart overcome that increased afterload from that vasoconstriction. So it can be helpful. But anytime we increase or we stimulate beta-1 receptors, we worry about a very specific side effect, and that's tachyarrhythmias. Because remember, these receptors, this beta-1 receptor, also increases our heart rate. And so if your patient's heart rate is already really high, 120, 130, and you're on higher doses of Levophed, your heart rate has a high likelihood of going up even more, which could be dangerous. So it's just something to think of. Now, anticipating findings with Levophed, I'm hoping that once I find that sweet spot, I will see an improvement in my mean arterial pressure, due primarily to the vasoconstriction. I'm also hoping, therefore, to see an increase in my systemic vascular resistance, my afterload, due to the vasoconstriction. I can also anticipate, hopefully, seeing a little bump in my CVP, my preload, the fluid coming back up to the heart. As we vasoconstrict, if we fill the tank, that vasoconstriction is going to force that blood back up to the heart due to the vasoconstriction. And I'm hoping to increase the cardiac output as well. More blood for the heart to pump, a decent blood pressure to get that blood throughout the body, therefore improving the cardiac output. So that brings us to our question. The nurse has started a norepinephrine infusion in order to prevent complications. they know to frequently check the patient's what? Now, if you said peripheral pulses, you are correct. Now, I know some of you guys may have thought urine output, decrease in urine output, but remember, what is the primary complication of Levophed? Is decreased urine output the primary complication? No. Peripheral necrosis, peripheral vasoconstriction. That is the primary complication that we're trying to prevent. And one of the best ways we can prevent that from happening is assessing our peripheral pulses. As they weaken, that's a big clue that we need to be talking with our provider about alternative ways to improve the patient's blood pressure.